Well, Senator Booker, I have a question for you about Medicaid and Medicaid expansion, but I want to start with a little bit of background.
Please.
As you may recall, when I was governor of New Hampshire, thanks to the Affordable Care Act, the program Medicaid expansion became an option for my state. And I worked with people of both political parties to make sure that the people of New Hampshire could actually get the benefit of Medicaid expansion. Expanded Medicaid meant that for the first time, working adults who couldn't earn enough money to actually buy insurance themselves, but who were working and single, could actually get health care coverage. Medicaid expansion meant that people with mental illness who wouldn't be covered by traditional Medicaid actually could get health care and could get coverage. People with substance use disorder, with addiction, could finally get Medicaid coverage and get better. And we worked across party lines, took a few tries, but we got Medicaid expansion done in New Hampshire. And today, Medicaid covers more than 180,000 people in my state, including more than 90,000 children, more than 15,000 people with disabilities, and nearly 10,000 seniors. And here's another number that people don't always think about. It covers 10,000 people who are getting addiction treatment. My state, as you know, has been very, very hard hit by the fentanyl crisis. And, just in when the president gave his joint address in March, I brought a woman from New Hampshire with me who had been suffering from addiction. Medicaid expansion covered her treatment. She got into recovery. She's now working in the private sector, but also offering counseling and peer recovery services to people who are trying to get their addiction treated through Medicaid expansion. And she is now on private insurance. I remember talking to another Granite Stater while we were working to pass Medicaid expansion. So she had been laid off from her job as part of the Great Recession, right? She had an ongoing chronic stomach condition. So as she got laid off, her health insurance went away too, and she couldn't afford the COBRA fee to keep her health insurance. So she couldn't get health care. So she got sicker and sicker, so she couldn't go to work. But because she was a single adult, she couldn't get Medicaid coverage. So here's somebody who has been working, wants to work, has a chronic illness, can't get to work. We passed Medicaid expansion. She got coverage, she got treatment, and she got back to work. The other great benefit of Medicaid expansion covering people with addiction in New Hampshire has been that as people have gotten better, as more and more physicians have learned to integrate addiction care into primary care, we have a lot more people in recovery. And like many of our states, we also have a workforce shortage. What's been happening now? New Hampshire is a leader in recovery-friendly workplaces so that people who got this Medicaid expansion coverage, got their addiction treated, got better, can go to work in the private sector and get private insurance. That's some of the benefit of Medicaid expansion. But of course, what we are hearing about now from the House and Senate Republicans is their desire to make massive cuts to Medicaid, including Medicaid expansion. And they're doing it. They want to rip away health care from millions of Americans so that they can pay for big tax breaks for billionaires and corporate special interests. So the Republicans have proposed cutting up to a third of federal funding for Medicaid. If those cuts go into effect, that could mean 30,000 children in my state will lose their health care coverage. That means 1 in 5 seniors in New Hampshire could lose their nursing home care. And all told, that could mean 60,000 people cut off from Medicaid, including, for instance, a young man whose parents I just met at the airport, actually, who has autism and Medicaid pays for his health care, right? But he could be cut off too. So if Republicans continue with this plan, I am really, really concerned about what is going to happen to millions of Americans who currently get their health care through Medicaid. So Senator Booker, Can you address the ways in which Medicaid helps provide health care for Americans and the disastrous impact it would have if Republicans proceed with their plan to take coverage away from up to 25 million Americans just so that they can pay for big tax breaks, by the way, for people who are already billionaires?
So before I answer the senator's question, I just want anybody who's watching to know that, I'll put it bluntly, this is one of the baddest ass human beings serving here in the Senate. You have been a governor of a state with all the challenges. You are beloved. I've spent a lot of time in New Hampshire, folks. It's after New Jersey. It's one of my favorite new states. No disrespect to New Mexico over here on my right. But I love your state. I love the people of your state, and they love you. You are an extraordinary governor. You are a trailblazer, a glass ceiling breaker, a name taker. You are a badass. And to have served with you as my colleague, you have the kind of leadership in the Senate that is needed more of. Somebody that stands in the middle and draws people together to common sense and pragmatism. I started on healthcare, some 16 so hours ago. And I read You Would Be Proud of Me, because she's one of these voices that comes to me and says, hey, Corey, let's bring people together. I know that the presiding officer, who's new here, but he has the same spirit of trying to bring people together. And this might be the third time I've seen him in the chair over the last hours, 17 hours. Thank you, sir. But you whisper in my ear all the time, we've got to find a way to do this together. We've got to find a way to put more indivisible into this one nation under God. And so I hope that you would be proud, because I told my staff, who prepared with days preparing all these sections from farming to environment, all the ways that Donald Trump is betraying his promises, betraying America, driving up costs, wrecking our economy, endangering us globally and here at home, and turning his back on a lot of our values, all while disrespecting this document more than any president I've seen. But I wanted to make sure, I told the instructions to my staff, pull from all the Republicans you can. We want to use the Wall Street Journal. We want to use the Cato Institute. We want to bring this together, because what we're standing up here is not to talk about left or right. We're talking about what is right or wrong. I do not want to talk about this being a Democratic moment. It is a moral moment. And you are the perfect senator to be asking these questions about healthcare to me because of what you stand for. You, when you got elected as governor twice, I think, when you got elected to the Senate here, you had to get votes from Democrats, independents, or Republicans, or you can't win in New Hampshire. I've been in your state. I've met the people. And God, you have a very participatory democracy up there. People feel like if you're not going north to south house parties, you have to engage directly with the people. They don't care what party you ascribe to. They want to feel you, see you. They don't care how much you know until they know how much you care. That's why I think you're such a badass leader. And so you would have been proud of me when I did the healthcare section, because I read from Republican governors and Democratic governors. 40 states expanded Medicaid. And all of these governors, all of these voices said exactly what you're intimating here is, do not let Donald Trump cut $880 billion out of Medicaid. It will crush rural hospitals. Yep. It'll crush level 1 trauma care centers. It'll crush organizations that deal with beautiful disabled children. It'll crush people who are struggling for health care. It'll crush nursing homes. It'll hurt red counties and blue counties. It will hurt America. Republican voices were saying that. And to have a bipartisan senator who embodies the spirit this place should ascribe to more to say these things is affirming the truth. Why? Why are they rushing to cut $880 billion, which voice after voice that I read said it would do so much damage to people's lives, so much damage to healthcare providers, so much damage to hospitals? Why? The only two things that will result from that is that they'll extend the Trump tax cuts, where the disproportionate benefits went to the wealthiest among us, who are doing better than they've ever done in this country. They don't need it. Taking money from struggling folks and giving it to them is not the answer. And then the other thing, to a person who, like me, when we were executives, You were a governor. I was a mighty mayor. We had to balance our budgets.
Right.
But they're not balancing the budget. They're not lowering the deficit. They're increasing it by trillions of dollars. This makes no sense to a pragmatic person who has balanced budgets, who expanded health care access, who made her state work, who has love and respect and votes, frankly, from Democrats and Republicans. You know this makes no sense. And so if you're standing up, and colleagues of mine further to the left of me, then why aren't other people why did only one Republican in the House vote against it? He told the truth. Massey. I see some of my Republican colleagues here. He's a fiscal hawk. He told the truth. This budget is going to explode the American national debt, stealing from future generations. I can't vote for this. He was not bullied like other people in the House into doing what dear leader Donald Trump says. And so, my colleague, you are on the money. I have internalized your voice. There's only a few people's voices I've internalized. One of them is my mother, but you're not that. You're more my peer. You are one of those voices in America right now that we need, that does not slip into a partisan argument, but makes the pragmatic argument that what Donald Trump is trying to do with the aiding and abetting of congressional Republicans is wrong. It is fiscally wrong. It is morally wrong. It will hurt Americans. It is not for the common welfare. It's not for the common defense. Read the start of the Constitution, please. I beg of you. We all swore to uphold it. How do our founders begin? We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the best blessings of liberty to ourselves and our prosperity. Trillions of dollars of deficit doesn't secure the blessing of liberties, it endangers our country. The common welfare is this idea that everybody should have access to what makes us free. What makes us free is not having medical debt. What makes us free is not being chained to uncertainty and security that if someone in my family gets sick, I will not be afforded. Still, the majority, or close to the majority, of bankruptcies in the United States of America are people who can't afford their health care bills. We need to find better ways to expand access and not cut more people off. You know this, former governor. There are a number of states that have these things called triggers, automatic triggers, that if the funding for Medicaid reduces to covering 90% of the costs, what happens in those states? Boom. Medicare expansion goes offline. So if you don't even cut it $880 billion, maybe you say, we'll just do $250 billion of an axe. States are going to lose their expansion. People are going to suffer and get hurt. Why? You said it, you said it, you said it. You and I are the two people that want to see entrepreneurs make money. You and I want to see small business people thrive. We don't hate rich people. We think that's great. It's often, not always, Donald Trump, it's often a sign of people in America using their ingenuity, applying it, and being successful. But you and I both know that the richest people in this country don't need more tax cuts. It is morally wrong. It is fiscally wrong. It is a wrong in the name of God and America. How could we be doing this to ourselves?
Will the senator yield for another question?
I can't call you one of the baddest ass people I've ever worked with and not yield to your questions, but I have to read the words. I yield for a question while retaining the floor.
Well, thank you for yielding the question for a question while retaining the floor, and thank you for the very nice compliments. I do have a question for you about Social Security, and then I think another colleague of mine has additional questions. But look, as you know, you just talked about my wonderful state, New Hampshire. You also just talked about your mother, and I should just also let you know that my mother always made me memorize the preamble to the United States Constitution. So as I listened to you read it, I thought,
shots fired on the Senate floor. Where's the parliamentarian?
I hope my mom is watching.
Rule
right
19
now.
her.
But here's my question, and just by way of background. As you know, New Hampshire's a small state. It's a very rural state. And recently, the Trump-Musk forces have announced that they want to close a Social Security office in Littleton, New Hampshire. Now, Littleton, New Hampshire, that Social Security office, which takes applications and provides technical assistance for people who need Social Security or need Medicare or who have questions about their current coverage, right? It is the northernmost office in New Hampshire. So they closed that office, and now my folks in the North Country, and there are about 334,000 people in New Hampshire with Social Security, right? My people in the North Country will have to drive as far as 100 miles to go to another New Hampshire Social Security office. And meanwhile, of course, they're laying off people from Social Security offices, and they're making it harder to get assistance via the telephone, which, as you know, many people who are on Social Security find the telephone the easiest way to make a connection, get technical assistance. So Elon Musk has called Social Security a Ponzi scheme. He says he wants to cut $700 billion from Social Security and Medicare. So my question to you, as we're looking at a administration that says that it wants to make things more efficient, but is actually laying people off, closing offices, making it harder for people to actually connect with the Social Security office, my concerns, of course, are that this is just going to delay claims, delay coverage, make it harder for people to get on Social Security, because actually Trump and Musk want to cut Social Security. Trump said, of course, that he was going to protect it when he was running for office. But now he's letting Musk do his cuts. So, Senator Booker, can you speak to the ways in which seniors across the country count on Social Security benefits that they have paid into? Right? This is not charity. People pay into the Social Security system. They earn the benefit. And can you talk about the disastrous impacts if this administration takes benefits, Social Security, Medicare away from our seniors?
Earlier, or last night, I had a whole chapter on Social Security outlining not just what you said, my colleague, my friend, but stories from seniors. And some of them really got to me. They were hard to read through. I have to say, I had prepped this by reading a lot of them, but somehow on the floor, when I read about the woman who had Parkinson's, when I read about the person taking care of their elderly parents, a spouse with dementia, children with special needs, and Social Security, it helps a lot of folks, but here's the craziness of the Trump attacks on the Social Security Administration. First, he makes people insecure about it. My mom lives in this amazing senior home, Las Ventanas, in Las Vegas, Nevada. Most of the people there, first of all, I love them all for who they are, not their party affiliation, but it's more Republicans than Democrats. And the stories my mom tells me about just the worry that they or other people in their family have because of Elon Musk calling it a Ponzi scheme, of Donald Trump talking about utter lies from the highest post in the land during a joint address, savaging Social Security with lies that everybody from conservative papers to Democratic papers to right-leaning, left-leaning papers have all called out lie, 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 lie. There are not millions of people receiving false payments. They've insinuated so much insecurity that people were writing me letters talking about they're losing sleep. They have so much anxiety because they only live on their Social Security check. And Brother Howard Luckman, who I know, and I don't know what he was thinking when he said it, a billionaire talking about his mother-in-law. I don't know what you were thinking, Howard. I just don't understand it, how you're saying if she misses a payment, she's okay, but if people complain, they're probably fraudsters. Do you understand how many millions of Americans only have that as their only protection between poverty and destitution? That if they miss a payment, they can't make their rent, they can't buy food? And so they've created so much insecurity, so much fear, and I compared it, Governor, I compared it to the difference between an FDR and a Donald Trump. FDR knew people were suffering. They knew people were afraid, and he stood before the American public and didn't lie to them, didn't attack people, didn't demean people, didn't degrade people. He comforted people. He allayed their fears. He inspired them. You have nothing to fear but fear itself. What an opposite in leadership. And so, yeah, there are a lot of people who right now don't know, but then my colleague from Massachusetts comes in and makes the very clear point, the professor we have in our caucus, she makes a clear point. They've already done benefit cuts because when you close offices in rural areas, that person who is missing a check or has an issue, now they have to drive, how many miles? 100 miles. Now, what is that hardship to a senior? I got heard from people in their 90s. They already are having benefit cuts. The Wall Street Journal, I told you, I was trying to make you proud. I wanted to get as many sources from anybody that was more center to right. And I read from the Wall Street Journal and said the customer service in Social Security is going from bad to worse. That was the title of the article. So they're already doing cuts. They're already launching, heaping insecurity on our seniors, heaping inconvenience on our seniors, heaping fear upon our seniors, heaping insecurity, making people lose sleep. This is wrong, 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 wrong. This is not a model of leadership. It's a model of cruelty and mean-spiritedness and hurting people. When is it enough, America? When is it enough that we say it may not be my grandmother that depends on that Social Security check, but I love America, and you cannot love Americans. You cannot love America. You cannot call yourself a patriot. Please listen to me. You cannot say you love this country and you're a patriot, because patriotism is love of country, but you can't love your country unless you love your countrymen and women. And love means that if somebody, some mother or grandmother is hurting, is afraid, that I'm going to stand up and do what I can to comfort them and fight for them. Because today it might be your grandmother, it might be your family with a disabled child. This is not right or left, it is right or wrong. This is not a partisan moment, it is a moral moment. Where do you stand? We started this by talking about John Lewis. It is time for good trouble, necessary trouble. Thank you, my friend. Even though you made fun of me for in my tired state not remembering the very important preamble to the Constitution.
Very well.
Thank you very much. That actually means I take your compliments because you don't give them abundantly or overly well, so thank you very much.